would love to introduce our guest. So I've got a bio written up here. So everybody, we have Brian Ivie. He is the president and CEO of Skagit Regional Health. I'm going to read the bio that was emailed over to me here. Brian Ivie, a highly experienced healthcare leader, serves as president, chief executive officer, and superintendent of Skagit Regional Health. Mr. Ivie took the position in November 2017 to lead Skagit Regional Health, which includes Skagit Valley Hospital, Cascade Valley Hospital, and more than 20 clinics across Skagit Island and North Snohomish County. Since his arrival, Mr. Ivie has overseen significant growth in the healthcare system located in Northwest Washington with service and geographic expansion. Skagit Regional Health launched a surgical robotics program in 2018, started a thoracic surgery program in 2019, has recruited more than 60 new providers since 2018, and has provided services with new clinics in Mount Vernon, Marysville, Oak Harbor, and Washington. Mr. Ivie serves on the Association of Public Hospital District Boards of Directors, the Washington State Hospital Association Public Policy Committee, the Board of Directors of the Chamber of Commerce of Mount Vernon, Washington, where the Skagit Regional Health is headquartered, and the Skagit Valley Hospital Foundation Board of Trustees. Mr. Ivie was recognized as the Business Person of the Year by the Mount Vernon, Washington Chamber of Commerce in 2019. Prior to his arrival at Skagit Regional Health, Mr. Ivie served as President and Chief Executive Officer of 3 facilities operated by Dignity Health, including Mercy San Juan Medical Center, a 370-bed acute care facility, Methodist Hospital of Sacramento, a 162-bed acute care facility, and Bruceville Terrace, a 171-bed long-term care and skilled nursing facility, all located in the Sacramento region. Under Mr. Ivie's leadership, Mercy San Juan developed as one of the region's largest and most comprehensive medical centers. His facilities in Sacramento received several awards and quality and clinical excellence, being named by Solusium as 100 top hospital in America, and by Health Grades as one of America's top 100 hospitals, along with more than a dozen Health Grade 5-star awards for clinical excellence. Mr. Ivie has more than 30 years of executive leadership experience in healthcare operations and finance at a variety of large profit and not-for-profit healthcare systems. He is a graduate of California State University, Northridge, and earned an MBA from Pepperdine University in Malibu, California. Let's go ahead and give a warm welcome to Brian Ivie.
Thank you. If you don't remember anything from that biography, I know what you were all thinking when he said I was in the industry for 30 years, because I know you're all saying he only looks like he's about 35, 38 on the outside. So I know what you're thinking, but I do appreciate that. You know, kidding aside, I really do thank you all for the opportunity to be able to talk about my favorite subject here today. There's a lot of great things going on in Skagit Regional Health that are impacting the region that we all are in. And let me just get this started real quick. Sorry. And again, nothing makes me happier than to be able to talk about it. I do want to start with a picture of Yola, being that it is her birthday today, and you know, you obviously all have a great relationship with Yola, and I will tell you, she is a key member of this team. All that she has done in the Arlington area and Cascade Valley Hospital, you know, her role has expanded to a regional role. And has played a huge part in all of our COVID efforts, which I'm going to talk a little bit about today. So, I mean, she really is a great person to have on the team. I start with COVID because everybody wants to hear what's going on. You know, it certainly everybody says we've never seen anything like this in our lives, and I am on that side of the ledger. This has been a pretty amazing issue that we have faced as a society. And my focus on the healthcare side of it is so you all have an understanding about the impact. The numbers are obviously staggering in terms of Snohomish County as well as Washington State and the country and world. In fact, I'm very pleased about the role that Skagit has played through our clinics and through our acute care hospitals in helping to provide a high level of care during this trying, if not interesting times. So when COVID really broke here in March, we had this situation all of a sudden where our lives literally changed in front of us. We have always been made our decisions focusing on our patients and the care that we provide to our patients. But COVID has created a whole new level of decision-making issues that we have to face on a daily basis, such as having to decide if we can do cases based on having personal protective equipment, which, you know, a year ago you would laugh if anybody said that you had to see if you had the right masks or face coverings or gowns for providing care to patients, COVID and non-COVID patients. And yet that's exactly what we had to do literally overnight. Our supply chain dried up completely. People were all over the country were caught off guard when this happened to the degree that it did. And again, although we have a lot of learnings from this, I'm very pleased with what has happened. We were the first in the region to set up some acute respiratory clinics, which seems like a simple idea, but what we were able to do was get people who were concerned about COVID or were infected with COVID, get them out of the emergency rooms, out of the hospitals that they did not need to be admitted, tested in a remote location away from the hospitals to provide a level of safety to everybody who still needs to use healthcare. And as you can see, it is a concept that is widely accepted and frankly is a standard for how people continue to do it to this day. We had to focus on our patients, our employees, and our providers. Had to take some huge issues regarding visitor policies, health screening, people who enter, temperature monitoring for our employees, and subsequent testing of all patients, which is not very well received, frankly, by people looking to receive care or who need to receive care. But it was a step that we had to take. Nobody wants to go through a healthcare crisis and not have a family member or a loved one with them. But it was a level that we had to go to be able to provide safe care to those who needed it. We certainly had immediate priorities from a financial side as well, and I'm going to talk a little bit about that. We don't typically speak about the numbers in any kind of specificity, but I'm going to do it today because it is quite amazing what happened in a relatively short period of time. So our immediate priorities when COVID hit was, how do we balance this potential surge that everybody was waiting to happen? Thankfully, in terms of our region, it hasn't happened to the degree that it has elsewhere in the country and the world, but certainly it impacted us greatly in our ability to provide care. We had to ensure that we had available capacity for when that surge did happen. We had to have opportunities for people to be isolated if they were in fact COVID positive. And then we had to also face the other side of it when people decided it was a great idea to stay away from the hospital. Then what do we do? And with lower census and things being stopped, like elective surgeries through the governor's mandate, that is a death to a healthcare organization. And as you can see, although not death to Skagit Regional Health, was a huge impact. This is a chart, and I hate to use charts like this, but it just shows the picture so well. I thought it would be appropriate for this group to be able to show it. But this little U that you see here, we call the Valley of Death and Doom. This was when COVID first hit. And you can see these are total Skagit surgical volumes, which on a daily basis, we're in the 130 to 140 range, and immediately dropped to the 40 range or below for a couple of periods, couple of weeks. And this caused a great deal of concern as part of our ability to manage our way through this. I want to be real clear in saying we are not facing as an organization anything different than you all are facing in your personal lives and your professional lives. But we had a little bit of an added issue in that we were required to continue to provide care. We want to provide care but we had to do it safe and effectively. And anybody who does know healthcare, and I think Bob would certainly agree with this, that the only thing that makes money in hospitals nowadays, frankly, are surgeries. Everything else is pretty much a very, very low margin, if not a pure loss. And so when we had to go through and our volumes were impacted, you'll see just what it meant for our organization. This is a chart that kind of shows for the major areas: admissions, ED visits, clinics, surgical cases, and GI cases. This shows what happened the first 3 real months of COVID. April was the bottom. April was a 100% pure COVID month. There was no ability to do elective surgeries or cases. And as you can see, all of our volumes dropped. These are areas, our volume variances to budget. So 60% of your surgical cases being gone literally overnight, and 90% of your cases also impacted us greatly. The good news is, as you can see, it is improving, and we certainly like that, but it is still having a major impact on us. And these are some of the numbers that I typically don't talk about, but I feel comfortable doing so with this group. These are hospital charges. This gray line is what is our budget. And yeah, you are reading this correctly. As an organization, you're looking at weekly hospital charges of about $29 million. And that seems like a lot, and it is a big number in terms of budget. But remember, it's healthcare, and in healthcare, you collect on average around 20 to 22 cents on the dollar. So this is gross, which is a big difference from net. So again, you can see the valley where it hit, where our revenues dried up dramatically. And obviously that's going to have a significant impact on our bottom line. And as you can see, this is representative of what has been happening. Last couple of years, we've been doing great in terms of our targets and overall bottom line. Started the year thinking, great, all we had to worry about was a little bit of snow this year. And we thought the rest of 2020 was going to be great. Then the bottom falls out. And as you see, bottom line levels these are pure losses. And for an organization like Skagit, that is a pretty significant loss to be able to take on a monthly basis. And it's even more important to note that these numbers out here in April, May, and even June, where we actually turned a little bit positive, include federal dollars, the care dollars that healthcare received, $100 billion, and we got our fair share to the tune of $20 million, which is great. But even with the dollars that we have taken to the bottom line year to date, we're still sitting at an $11 million loss. And again, as a public hospital district, or two public hospital districts, to go from a $9-ish, $8-9 million gain to for literally half the year, an $11 million loss, that's a big swing and an issue. And so my responsibility and the teams, and I put all the burden on Yola, I might want to add, is to get us back to where we need to be. Not just because we need to make money, but because we need to reinvest in our communities and the care that we provide. This just highlights the dollars that we received. We did receive, again, $20 million that we are very thankful for. But you will hear pretty much anybody in healthcare say, it's fantastic, we got it. It's not enough. It's not going to make up for the shortfall, but it is certainly better than not having it. So then what happened in terms of COVID, and this continues to be an issue that we're facing, is with the elective surgeries originally not being able to perform, the governor at the end of May did change his mandate, which was great for us. You have people who are now very, very comfortable staying as far away from any healthcare facility that they can. They don't want to come into the hospital unless something is majorly wrong. They don't want to see their provider for their annual visits. They feel very comfortable avoiding it. What we were seeing is medical problems getting worse. And this is not just for the sake of saying it. We are truly seeing an increase in the acuity of our patients that are coming to our emergency rooms, and it's specifically related to putting off care that has been necessary but people didn't feel comfortable getting the care. So this remains a problem throughout the country. This is the advisory board, which is one of the premier think tanks in terms of healthcare in this country. And these charts, the details aren't that important. But what they say is, given the choice, people are putting off their procedures, and they continue to look for any way to avoid coming to seek care should a condition exist. So we're not alone in this region, but it is an area that we continue to face. So there's some positives that come out of this, and one of them is telehealth. People, while they were staying away from their physicians and providers, they looked for opportunities to get some advice or have a nagging problem checked out remotely. And this is actually a very positive thing that has come out of this great challenge. People are starting to become more comfortable, in fact, demanding opportunities to be able to see their providers without coming to our facility. And I see this as a huge positive for our region, particularly with the remote areas that we all serve. It helps to get people access. And again, that's one of our major focuses. This, again, another chart, I'm sorry, but simply highlights on a weekly basis the split of our visits to our either a provider or via phone or video. And the orange and gray represents, as you can see, people who are not were not coming to a physical visit, but did it remotely, did it either through the telephone or through their computer. And to make it look a little bit easier, this looks at all of our clinics. So this is just the physician arm of Skagit Regional Health in the north and south. And before COVID, you can see video visits were literally nothing. We have an opportunity called eClinic that very few people took advantage of. And you can see immediately a huge increase. And even though it's been coming down, there is still a great demand for that opportunity. So we have looked at it as an opportunity to expand our care and expand our services, and are developing a telehealth strategy. And again, throughout the country, the interesting thing is there's always been a huge disconnect prior to COVID. People always said, I'm willing to use some sort of telehealth, some sort of remote visit. And then so 66% of people surveyed said they were willing to do it, and less than 10% of the people actually do. Well, this also fits into, COVID aside, fits into the opportunity for the future as our number of providers throughout this country, as baby boomers continue to reach the age where more healthcare is necessary. Telehealth can be a huge bridge to help bring the care to those who need it, and frankly expand the services of our primary care providers. So I actually think it's a wonderful silver lining, and something you're going to hear a lot more about in terms of the development of our telehealth strategy. So what we're focusing on right now as an organization is frankly recovery. How do we get people feeling comfortable coming back to the organization or to receive care? The governor was very good to us in terms of changing where we were in our recovery phase. We are now at the contingency care phase, which simply says we can continue to do all that's necessary as long as we have two things: beds available should a surge happen, and access to that ever important protective equipment that we need. So that's been our area of focus, along with, and Yola can certainly talk the rest of the time about expense reduction and control, because we do have to look at operating under a completely different market in terms of what's going on from a financial side. So we provide safe environment by doing some things that some people like and some people don't necessarily care for. If you're going to have a procedure done in any Skagit facility, you will in fact be having a COVID test within 3 days of that. At first, this started off and people didn't like it. Now it's very common. I mean, you can't get into the state of Hawaii. I guess that changed. You can't do a lot of things without yet getting a COVID test. We are obviously doing all the things that you are all doing in your lives in terms of social distancing, cleaning, and we are continuing with a limited visitor policy. We've softened up a little bit so people can in fact have visitors, but we still are maintaining a single visitor for each patient, again, to provide that safe level of care. We are trying to work along with the Washington State Hospital Association on having people understand that it is safe to come back. We are obviously taking the steps to ensure that safety. It's still an unnerving feeling when you're walking around and everybody is wearing a mask, or everybody is wearing a face mask and a mask underneath. But that's our new reality for some period of time. And again, a year ago, if you saw somebody walking around Costco wearing a mask, you'd be really shocked. Now you're more shocked if somebody tries to get in without one. So again, just part of our new life. And I'll end this part of it with logistics and PPE. Going back to my original statement, we are still forced to continue to make decisions based on availability of PPE. We are looking to maintain about 40 days of supplies, which is higher than you ever would do in a normal situation, but important in this in this time because of the supply chain being completely slowed down and stopped in some ways. We are doing some things in terms of purchasing things that are not necessarily done in a normal fashion, sourcing directly from China, which we typically don't do, utilizing local manufacturers, joining other hospitals in terms of co-purchasing supplies, because to buy certain things, it's a high number that we don't necessarily need over a reasonable period of time. It's sad to say that there's certainly opportunities for price gouging and price increases, which you're all seeing everywhere as well. But the PPE side of this remains a major issue as requirements continue to change in terms of how people need to be protected based on what the form of this virus actually is. Is it airborne? Is it droplet precautions, et cetera? So we have to focus on that. There are some other things besides COVID going on, obviously. While we're looking to stabilize and find that new normal, we are focusing on implementation of some pretty large strategic initiatives. As part of my bio, it talks about my focus on growth. I think that is the secret for our organization and for healthcare in this region. You are seeing an ambulatory surgery center that I think has been underutilized at Cascade for several years, now being reopened and becoming even more important part of our provision of care. We are focusing on provider recruitment. So we talked about over 60 over the last couple of years, and that's what's necessary to be able to continue to expand our services. And when I say expand, I mean access to and the level of services that we need to keep people in our community versus having them go either north up to Bellingham or south down to either Everett or Seattle. There's no reason why we can't be the provider of choice in the services that we provide. Recently added, as part of the service expansion, 3D mammography at Cascade, and Yola should take a lot of credit, whether I'm here or not, and if she does take credit for it, it's actually legit in this particular instance, because she'll take credit for a lot of things, but she really did do an exceptional job to provide this 3D mammography, which is something that is not only state of the art, it is a necessity in terms of mammography and finding earlier detection of cancer or issues for both men and women. Cascade ENT has joined Skagit Regional Health. They were in Arlington, Anacortes, and Mount Vernon, and recently closed their Arlington office. That was prior to them joining Skagit, but they still are an exceptional group and continue to serve the Arlington market. Will in fact be doing surgeries at Cascade Valley Hospital. So we're very pleased that they are now part of Skagit Regional Health. And then a big announcement that just came out recently having to do with the neighborhood clinic, the UW neighborhood clinic down at Smoky Point. Effective November 1st, that neighborhood clinic will become Skagit Regional Health. Our partnership with UW will continue in a lot of different ways, but not in the operation of that clinic. So it is our step towards enhancing the primary care presence in our region. And I will say without being able to go into a lot of details, it is not the last step you're going to see in terms of a primary care expansion strategy in the South. With all the growth going on, and frankly, all of the real, for the future, the positive issues about being in Arlington and having a great hospital like Cascade Valley Hospital is our ability to grow and provide additional services even further to the south, which might end up at Lake Stevens, but you didn't hear me saying that. We are continue to focus on the growth in surgery. And again, this is Skagit Regional Health, but every one of these items is both the north and the south. Orthopedics is a large and growing service line at Cascade Valley Hospital, very important service line. We have an exceptional new orthopedic surgeon who joined us, Dr. Valinga. And really, you're going to see continued growth in that area. Cancer care, both to the north and south, remains an issue. Women's health is an area of focus for us. I think it goes without saying, it's not where it needs to be at Cascade just yet. It has been an area of opportunity and necessity for growth for our future, and something that we are very focused on growing in the future. We talk a lot about the providers and the recruitment. These are just some of the recent starts, and the thing I like about this is you're seeing key service lines in terms of general surgery, primary care, women's health, OBGYN, general surgery, and there's ortho somewhere. Actually, ortho started right before this. So the issue is these are part of our efforts to expand this service is to increase the access and to bring the recruited providers to our area to be able to build on these services, which is going to be the secret of our success for the future. I would like to end this, and I jumped around a little bit, but I want to be cognizant of your time. I would be remiss if I didn't talk just a second about the unbelievable generosity and support that Skagit Regional Health and others have received during this incredible time. I am, being from California, they're not as nice down there, and I don't mind saying that. You have communities here who have truly stepped up to help our hospitals, help our employees, thank our workers. And it might seem like minor things like Boar's Head buying hams for all of our employees. It seems like such a small thing. It was so appreciated and felt by the healthcare workers who were frankly going through a pretty tough time. And it really did make a difference. And so to see the outpouring and support of things going on is just something that it really got to me, and it's something that I think as a community we should be extremely proud of because it really did make a difference. With that, I want to leave you with, we are here, we are ready. Whatever needs arise, my goal is for Cascade Valley Hospital, our clinics, and Skagit Valley Hospital to be the places to receive your care, not just because of their geography, but because they are the best place to receive care in this region. And that's going to be my task and Yola's task for a long time to come, but that's where we're headed as an organization. With that, I've reached my time limit. Any questions?
Brian, I've got a question. This is Campbell. In our area, we're starting to see the showing up of Kaiser and, of course, Everett Clinic with its relationship with United Healthcare. Providence has got a health plan. Where's Skagit in developing both a Medicare option that is focused on Skagit Health as well as an option for commercial to sign in and have it as a primary focus for Skagit Health?
Well, our efforts remain very focused on the expansion of commercial insurance products. As we sit here right now, we are not heading down the path of Kaiser, where we will be creating our own insurance product, for lack of a better term. Our ability to be successful in this will be through partnerships. And the who and what behind that is the difficult part. we're in an area, and what's going on in Smoky Point is the perfect example. You've got Kaiser coming in, you've got Everett Clinic coming in, you've got a lot of steps being made, and we have to be able to battle that. It will not be through the creation of an insurance product. I'm one that believes you don't have to make it all the time. You can certainly buy it, and you can partner with it, and that's our strategy right now, because it is important.
Thanks, Brian.
Thank you. Oh, good, a quiet group. You see, you can always quiet people down when you talk about healthcare. It's pretty easy. So,
Brian?
Yes.
Gene Chase here. Hey, when you're talking about expansion, one thing I think you might look at in your data thing is in your OBGYN field down here, you know, they come and go and the door opens and shuts and so on. And, you know, the thing I hear a little bit out there on the street is, you know, they got like one maybe is at Mount Vernon halftime or so on. I think you got to figure out a way to have like two of them here full time because what happens if they're told they got to go to Mount Vernon, they get out to I-5 and they, well, might as well turn left and go to Prob or Everett Clinic.
Yep. Gene, you are 100% correct.
Don't tell him that.
Oh, I'm sorry. Okay. On this particular item, you're 100% correct. How's that? It has been a challenge in that, as right as you are, the number of cases to keep a provider competent and busy has to be at a certain level. So yes, we want permanent, 100% dedicated OBGYNs in the Arlington market. We might have to, and we are headed as such as early as, knock on wood, if it doesn't change this week, in October. We do, though, need to allow the OBGYNs or the providers to have a presence in Mount Vernon to be able to keep their numbers up in terms of admissions, but that has to be a very small percentage of it. They need to be dedicated to the market, to Arlington and to their location. And so you're right. It is not. We have not been successful yet in having that stick. We don't want to see a revolving door. And frankly, we have a wonderful midwifery program, which I think is exceptional down there. But we can't rely on midwives either. We need OBGYNs who are there and who are dedicated to the region. So, point well taken. I'm hoping that the next time we get a chance to talk, you will see the results of those, and you will begin to see the change. It's not gonna happen overnight, but it's coming.
When you get back to Mount Vernon, you'll see my good friend Bruce Lister. And tell Bruce Lister you told me I was 100% right. He and I go back a long time.
I will send him in a cardiac arrest.
And knowing Bruce, I bet he'll have a response for that too.
Yes, he will.
Hey, Brian, this is Dave Duskin. Can you give us some history on the Smoky Point general practice? Why did it ever go to UW and now coming back? I was out there when Mark Spencer moved out there, and then there was such a heavy turnover. And I had to call Seattle to the UW, which I find offensive, to schedule an appointment. So I bailed out of there and went to one of your other clinics, but I'm really wondering why it was ever UW.
Let me tell you, Dave, when I first got here, I did not understand the move either. The intent of it was UW does have name recognition, does have a large system of care, and it was intended to help raise the bar in terms of level of care that's provided in the area. The reality of it was it really provided a road out of Smoky Point down to UW when it came to referrals for specialty care, et cetera. But to be able to do the move that we've made now, we had to ensure that we raise that quality bar and that we can be that provider of choice. And so now we're ready to do it. And frankly, UW is ready to allow it to happen because they feel comfortable about where we are. And that was not always the case. But I actually think it was, in the overall scheme of things, I don't think that setup was in the best interest of permanently raising that level of care. So you're right in what you're saying. And I hope now that with this move, we can show that maybe we can consider these years of it being associated with UW as helping us to become even better at what we did, or what we do. So, because you're right, it was a very interesting strategy. And for what it's worth, it doesn't necessarily fit with UW's strategy as well. So it really didn't fit the partners all that well.
Brian, I had a question about the revenue drop. With resources being shifted over to dealing with COVID, did the revenue drop, is that because of you're not able to recoup the cost of care from like insurance companies, or because of everybody walking in the door, or is it just not enough elective surgeries to coming in?
The sum of the three. The elective surgeries drying up was by far the largest hit. The overall volume decline hurt drastically. The patients that we did have, and this is particularly true up at Skagit Valley Hospital, the COVID patients, people think that with all the COVID activity, that's actually a moneymaker. The resources that you put towards providing care under a COVID situation hurt a lot. So all of those together meant a margin that, remember, we're dealing with a 3% margin to begin with. Those kind of revenue decreases and cost increases is what really killed the margin. So, but as you saw from the charts, hopefully on the right direction now, because we're still going to have to live with the cost of providing care in a COVID-19 environment for a good while to come. So, but that's the impact.
So Brian, on that line, what kind of cost increase has the system between both facilities incurred in the keeping the patient safe and the staff safe with the PPE? What kind of increase in cost has the system incurred by that?
I can tackle one of those, a big one, if you don't mind.
Take it.
The COVID testing that was developed first in the state with the University of Washington when the Department of Public Health couldn't quite keep up with demand. The cost for those tests was a cost that we certainly didn't budget for. You know, we're looking at $200 per test per patient, and we're testing 480 to 500 people a week right now. So that just added hundreds of thousands of dollars of costs, and Medicare doesn't reimburse us $200. They might only reimburse $80, and then the other payers generally follow suit with Medicare. But that's certainly one of the costs. The other is screeners. You know, we had to hire staff to sit at our entrances and provide screening activities to make sure that our patients were safe, our employees were safe, visitors that were coming in for good reason were safe. But those are a couple of big things, and not to mention, price gouging that happens as a result of the PPE supply and demand. That's big. Brian, I don't know if you could think of others.
Those are the big ones. If you were going to put it in number standpoint, with a 3% margin, the cost increase alone ate up that margin. So that has nothing to do with the revenue decline. We're actually going through the process of accumulating all of these costs as we speak. We're hopeful for some potential FEMA reimbursement, et cetera, but it is in the millions of dollars so far and continuing.
Any other questions for Brian? Well, I just want to thank Brian for coming today. Speaking about him as a boss, he is a phenomenal guy. He is a beacon for us. He came to us in 2017, and I couldn't be more happy that he did. He generates a lot of goodwill within the organization. He truly puts our patients first at every decision that we do strategically and operationally. And it's a pleasure to work with him. So thank you for coming and sharing about COVID and everything else that we're doing. Much appreciated.
Well, thanks, Jill. I appreciate that.
You bet.
Thank you all for your time. I appreciate the opportunity. And if I can say, this group has got such a great positive energy in the way you do with each other. It's quite impressive. So I thank you for the opportunity.
Tell Bruce